Recently, there has been an outcry from the nation for more focus on mental health issues in the United States. Earlier screenings, accurate diagnosis, and better treatment options are being lobbied for from people of all walks of life, even celebrities such as Demi Lovato, who at the Democratic National Convention spoke out about her struggles and victories with mental illness at a very young age. There are a number of America's youth suffering from illnesses just like Demi, about 20%. Though a large number of children in the United States suffer from mental illnesses, around 1 in 10, 70% of these youth do not receive appropriate treatment. Children with emotional behavioral disorders are put at even more risk for poor school performance, risky sexual behavior, incarceration before leaving school, and becoming teen mothers. There are several theories used to explain why canine-assisted therapy is a successful alternative treatment for children with EBD and anyone with psychological disorders in general. The learning theory is one theory that helps support the use of canine therapy. This theory explained that behavioral concepts of positive reinforcement explains why humans associate a positive experience with a friendly dog, which oftentimes can be therapeutic. Therapy, both physical and psychological, can oftentimes be uncomfortable, but introducing a dog can lead to positive associations with therapy and lessen anxiety. This theory hypothesized that by using a positive reinforcement object or activity, attention can be diverted. This helps strengthen coping abilities. This theory has been applied in a number of studies involving adults and children with intellectual disabilities, trauma, such as sexual abuse, and behavioral disorders such as ADHD and anxiety. These studies involved both qualitative and quantitative accounts of the effects of the use of canines during both inpatient and outpatient therapeutic activities. The learning theory and how it relates to canine therapy will play a large role in explaining why canine therapy is an effective form of alternative therapy for children with EBD. In order to identify effectiveness of animal-assisted therapy on children with EBD, I included studies that included adults and children with social, emotional, and cognitive disorders, as well as studies on the physiological effects of bonds between humans and animals. These studies took place inside various venues such as hospitals, schools, and outpatient clinics and labs. Studies were reported in English, and in an effort to analyze only the most recent findings, must have been reported no sooner than the year 2000. This table showcases the inclusion and exclusion criteria for my review. Ten studies remained after the literature review, 5 quantitative studies and 5 qualitative studies. Here we will discuss the 5 quantitative studies. First, Stefani et al. Conducted a random controlled trial inside of a psychiatric hospital involving children admitted with acute psychiatric disorders, ages 11 to 17. Their intervention involved an already standard protocol treatment which had a canine incorporated into the therapy. This showed significant differences between the treatment and control group in the areas of global functioning, school attendance, and improvement in socialization and group therapy participation. Schuck et al. Conducted a random control trial in an outpatient therapy session involving children with the mean ages of 7.91 and 7.88 with ADHD. The intervention group included the participation of 3 certified therapy dogs, and the non-intervention group received the same standard treatment curriculum but utilized a toy dog in lieu of a live dog. Results showed that all participants saw a decrease in the severity of their ADHD symptoms. However, the group which involved the live canine showed a much greater reduction in the severity of their ADHD symptoms. Brown et al. Conducted a quasi-experimental design at a summer day program involving adults with intellectual disabilities between the ages of 17 and 50. This intervention incorporated pet care to enhance their ability to follow instructions and manual dexterity, as well as participation. The results for this study showed no significant improvement. However, anecdotal evidence from the staff at the summer day program did say that those who received the pet care intervention did have more participation. Dean et al. Conducted a review inside of inpatient facilities with children and adults with psychiatric disorders. The intervention involved incorporation of canines and other animals into their therapy sessions. The results for this review showed that animal-assisted therapy was beneficial, especially with those with severe psychological disorders and those with persistent negative symptoms of schizophrenia. Animal-assisted therapy using farm animals also showed to be beneficial for individuals with depression and other forms of psychiatric disorders. Rabbit et al. Conducted a comparative study online involving two groups. Group 1 with participants between the ages of 18 and 60, and Group 2 between the ages of 20 and 64. Each group was presented with case studies and then presented with treatment options, such as animal-assisted therapy, medication, psychotherapy, and wait-and-see or no treatment. They were then asked to rate the acceptability of each treatment immediately after they were presented with that treatment. It was shown that over 80% of the sample had high rates of acceptability, and less than 10% of participants had a low acceptability range. This translates to strong support for the hypothesis that animal-assisted therapy is seen as a very acceptable treatment, and also by the vast majority of participants in the study. Qualitative studies. Gelongo et al. Conducted a study inside of 2 second-grade classes in a pediatric floor of a hospital, involving children between the ages of 5 and 8 who suffer from reading difficulties, stress, and depression. They reviewed therapy dogs as adjuncts in classrooms and patient rooms. Their evidence supports the use of therapy dogs as a positive force on children's physical, social, and psychological well-being. Grand George and Hausberger conducted a study inside of a mental health treatment facility and inside of other outpatient facilities with children, adolescent, adults, and elderlies who were inpatient or outpatient. They reviewed the human-animal bonding effects on the well-being of humans, and it showed beneficial to both partners. A large field of research opens up by giving greater attention to the animal and by studying their respective well-being. Dmitrievek studied therapy sessions in both in- and outpatient facilities with women in psychiatric treatment facilities and children in group outpatient therapy. They reviewed psychiatric therapies involving animals and the effects on their patient. And this showed animal-assisted therapy brings great benefits for chronic patients with lengthy hospital treatment. The bond between animals and patients eases the adaptation of the new patients to the stressful hospital environment, helps in the reduction of anxiety, stress, pain, and they also saw a decrease in blood pressure and improvement in mobility and muscle strength. Sorelli et al. Conducted research inside of psychiatric institutions to review the potential for domesticated animals such as dogs to provide emotional and physical opportunities to enrich the lives of many frail subjects. They saw that there is a positive bond between humans and animals. However, there needs to be increasing research to standardize methodologies for a cautious and effective use of animal-assisted interventions. Friesen conducted research inside of therapy clinics and classrooms with children with severe emotional disorders attending school. She reviewed benefits occurred by children as well as the concerns with programs which involve the animals, in particular in school environments. She found that animal-assisted therapy intervention usually takes place in therapeutic, medical, and classroom environments. It seems likely that these settings invite stress in children, but that the calming interaction with the dog may help to alleviate some of these anxieties. After reviewing the quantitative results and the qualitative results separately, I then synthesized them together for key themes. Key themes found in the research suggest that human-animal bonds alleviate stress and anxiety. This can also be explained by the learning theory, which states that a positive experience in therapy, for example, the comfort of a non-judgmental dog, can make it more successful by reinforcing the positive aspect. This has been proven in the study conducted by Maljean et al., which found that when adding a canine into therapy sessions, there were improvement in symptoms such as depression and anxiety in adults and children suffering from schizophrenia. Dmitrievec found that not only did introducing canines into his patient's therapy regimen reduce mental ailments such as stress and anxiety, but improved his patient's blood pressure and muscle strength as well. Though there are positive results from the animal-assisted therapy, another key theme does indicate that broader research will need to be conducted in a number of venues. Sorelli et al. Suggests that increased research be conducted on why the human-animal bond is so successful, which could give more grounding to animal-assisted therapy and its uses in mental health. Involve publication bias, which could also be related to personal bias. It's safe to say that the majority of people like animals. Many people love animals, especially dogs. Though personal thoughts on the researchers who wrote the studies included in the review can't be determined, it wouldn't be too far-reaching that the researchers may like dogs or even be passionate about them enough to conduct the type of research they have. Because of any personal bias the researchers may have, this could affect which publications they market to as well. Another limitation for my review is limited included studies. From experience in reading other reviews, their inclusions of studies were much greater. Because of the lack of time and resources, I could never look through hundreds of studies in the time allotted for the assignment. I did try to find the best possible studies, but it is possible I could have missed studies with different outcomes or stronger outcomes compared to some of the studies I included, though all of my studies were high scoring, so the results will be valid. And that this research be used to help shape policies and protocols for the treatment in children with emotional behavioral disorders. I recommend that this research shape policies for the way that facilities accommodate therapy animals. I also recommend that kill shelters who take in stray or abandoned animals could essentially be changed into more training facilities to rehabilitate these animals into therapy dogs. As the demand for therapy animals increases, this will meet the demand more. Also, I recommend that a flagship school or mental health facility take on a pilot program that is long-term and extensive, which utilizes therapy dogs specifically for children with emotional behavioral disorders.